Great. So now we are reaching the last session, which is about actions concerning developing new tools and guidelines for the project. So it's really like almost like the last part of the project where we kind of gather everything that's been learned and produced and make it kind of available and translated into tools and recommendations that can be used in the next step and scale up some actions that were very successful during the project. Here I would first start with just showing that actually, if we kind of make a list of everything that's been developed in terms of tools during the project, that would be available for different types of animal health sectors. I could gather a total of 31 tools so far, among which some are associated with the analysis of data and data sets. So you have genetic data sets, the data sets coming out of the community animal health reports. We have tools to do analysis of animal mobility, of economic impact, or estimation of immunity coverage in livestock populations, for example. Then we have also tools that are more associated with lab activities, so protocols for diagnostics, for genetic characterization of the viruses. We have guidelines for to improve vaccine production. Then we have quite a lot of tools associated with training. We have a lot of training material that are either in form of online courses or video training material that are on a wide range of subjects: stats, epidemiology, genetic analysis, socioeconomy, sampling design, GIS, etc. So a lot of things that will be of interest to people working in animal health. Like,
excuse me, Arnaud, I don't see the slide. I don't know if it's only from my side or.
No, it's me. I think
okay.
I did show it only on my screen and not on the other screens. Okay, I'll just move back. So as I was saying, 31 tools developed, 5 for data analysis so far, 4 for lab activities, 11 for training materials, and then we have some tools for better engaging communities. So those are like the posters, the flyers that are bringing information about how to identify the disease, what should be done, about the importance of vaccination, so a lot of tools that can be used in Nigeria, but also in other places to raise awareness and engage communities. Then, very importantly, we have multiple field tools, typically electronic forms that are used directly on the phone while in the field to record data. So some of these forms are targeted to researchers, some epidemiological studies or socioeconomic surveys, for example. Others are targeted to the communities, for the community animal health workers to report suspicion of diseases, and of course also these forms will be very useful for veterinary services. So quite a lot of material that at the end we plan to have them accessible through a centralized system that we are going to present in the next slides. But first, I'd like to leave the floor to our partners at ICORE to give us a bit more about community animal health workers and the reports they produce and the importance they represent as a tool for surveillance and control of animal disease. So if maybe Banga, you can take the floor here.
Good morning once again. For 2023, over 28,000 disease reports were actually submitted by the community animal health worker, and over 1,000 of that were actually Newcastle disease, and PPR, over 2,000 were for PPR disease. So actually, this is how the sample of our dashboard actually looks like on presentation. So, and then it shows you the number of reports. It shows you the classes of disease present, reported for that particular, maybe for the particular month or for the particular period. Shows you the class of disease within the small ruminants. It's also show you the disease reported based on the community animal health worker who is actually reporting more. It also shows you the map of the of where the reports are actually coming in from, and also we're also able to link our the reports coming in from the distributor also into the dashboard, especially for community animal workers that are actually accessing vaccines. So it also shows the type of vaccines that the community animal workers are actually making use of on the field, especially with the Newcastle and then the PPR vaccine. And then it also tells you and the number, the community animal workers that are actually making use of the vaccine and the type of vaccine that they are making use of. And then it also shows you the map of the where the vaccination is actually taking place. Then again, from these reports too, we can actually generate the number of farmers that they are also engaging with. If it is a female farmer, if it's a male farmer, it also disaggregates it. So generally, this is how it's how the dashboard is presented. So so I think Arnold, you may want to go to the next slide. So another thing that we've also realized over the course of years is that the community animal, the supervision of the community animal worker is the bane for any community animal workers program. So because these supervisors provide both off-field and on-field support to the community animal health worker. And then when referrals are needs to be made, they refer to this community, to the supervisors. So with strong supervision, there will be consistent reporting by community animal worker, because we've seen over the years that community animal workers are actually needed in the community, and they engage with farmers and they see this as business on their own. They see it as business. However, the major thing is about getting them to report their activities on the field. It's not just about reporting an outbreak of disease, but then continuous engagement of the state on their activities on the field. The numbers of engagement they have with farmers, those are very important. Even if it is just ordinary deworming, it is important that the state are aware of all these activities going on, because on the long run, it also helps them to the state to generate data about what's actually happening in their state, and then they can now plan in the future, for future sake. So the supervision is very key, and then proper investigation of disease reported by CHO and feedback will be provided to the farm. So another thing that this helps is that on the long run, when this report gets to the state then knows the type of information they are supposed to get to feedback to the community or to the community animal worker. So what next? One thing that we want to do is to hand over the reporting system to the state DVSs and integrate it into the current surveillance system in Nigeria. We are looking for ways to actually do that by engaging with FMAPs, and then we shall be having some technical training for the state on the tool usage, how to manage the tool, how to actually, if there's any technical hitches that we have seen, because we've had opportunity to actually understand the major technical issues that can take place, and we've tried it with engaging with some other supervisors, and it's been really working on the field. So these are some of the things that we'll be passing over to the state in order for them to understand how the tool works in terms of the technical bit, and also how to download the data, and how to also understand the results from the from the data, because one thing is about seeing the data and you may not even understand what is going on the platform. So it is important we put the state through, we have a hands-on training for the state and their various supervisors. And again, we will be working, as I said earlier on, we'll be working with FMAT to actually possibly see how we can integrate the tool with NADIS. Thank you.
Thank you very much, Banga. Indeed, very important work to be done to be sure that all this work and information of reporting from the community animal health workers, it's really being handed over and being used within the surveillance system at state and federal level. And this and other tools we have developed, we hope that they can be handed and through an information system that we are trying to put in place and present to the different stakeholders. And I will leave the floor to my colleague Raphael to give us a few words about the information system we are trying to put in place. Raphael?
Good morning, everyone. Can you hear me?
Yes.
Great. Okay, yeah, so we have implemented an information system to support the integration of data and to retrieve information for all stakeholders that are involved in the project and surveillance and control activities. So for now, we have a system. It's a web server that hosts three main apps. As you can see in the center of the screen, you have Nextcloud. So maybe some of you know Nextcloud already. It's an app like a Google Doc, let's say, but it's private, and then you can download and upload any kind of documents. And you have also many other functionalities like web conferences, mapping, etc. So it's open source and developed by a large community. So it's a very powerful and interesting tool for us. And so for managing the confidentiality and accessibility for the apps and data, etc., we have implemented Rosemary. So Rosemary, as you can see on the left, with my own account as a manager, we can define who will have access to what. So which folder in the Nextcloud or which app in the web server, etc. So it's a very interesting tool to work in a project where everybody cannot access to the same thing at the same level. And we have implemented also like the GEOPS apps, which is a web-based geographic information system, because mostly the data are geographic data. So location, as an example, on the left, your location of samples or surveys, that are positive or negative regarding the status of PPR. Yep. So next slide, please. So we have done 4 participatory modeling workshops. So now we identify 4 information services. They are the kind of services that are useful for stakeholders. So a rapid alert system, so mapping suspected case and confirmed case, outbreak, etc. An investigation intervention services, So if you want to make an intervention in a specific area, you may have access to information such as surveillance facilities, vaccine sales, vaccine availability, etc., to improve your investigation. Another information service regarding risks assessment for policy making. So it's much more regarding a forecast, so including modeling. So the kind of modeling you have seen just before, risk mapping, and also dynamic modeling, and a science society dialogue information services. So it's a place where farmers, cows, and the policymaker can exchange knowledge regarding a diseases, outbreak, and consequences of outbreak, etc., etc. So next step is to install it on a proper way on the web server first, to give access to all stakeholders in the project. And of course, the objective is to provide a tool that can be installed on any web server in Nigeria, finally. And so we have to finalize the code design and implementation for the information services, integrate Kobo Collect. So what Menga just showed you before. So the field form can feed the database of the web server, so we can automatically display, for instance, information collected by cows on maps through the information system. So of course, a workshop to present the tool and agree on the rule of access. I talk about Rosemary, so we have to define who can access to what. And then finally discuss with the Ministry of possible links with other existing tools like NADIS. Next slide, please. And regarding the modeling, the surveillance and control system, we have developed a tool that can integrate dynamical and network modeling and discrete modeling also to design surveillance and control systems. So this tool is operational, and the same way as before, we have to integrate this tool in the platform and start to test it with a surveillance and control designer in Nigeria. And of course, this link the model with the data collected. Thank you. I think
yes, thank you very much, Rappel. And now we will move to the very important part about how we do evaluate the impact of the project and how we will draft recommendations based on our actions. And I think I will leave the floor to Sophie for that.
So in the final year of the project, we want to evaluate the effect we've had on communities, of course, but also the veterinary services, the laboratories, and on the project partners as well. So to do this evaluation, we developed a methodology during a workshop that was organized in Rome with the assistance of the Desira Lift monitoring and evaluation team. And our idea was really to have an evaluation that would be useful for all stakeholders. It takes time and resources to do evaluation, and we wanted to really have a utilization-focused evaluation plan. And so it was a very participatory process. So we had a lot of brainstorming. And if you don't mind going to the next slide, just next slide. So we defined 3 broad uses for our evaluation. And the first one is to obviously document the effect of the project. And we want to underline all the strengths, weaknesses, and potential opportunities for the future. Then the second objective is to really try to see whether we actually did what we were expected and whether we produced the expected results in terms of improving the livelihood of farmers, the skills and capacities of the various animal health actors, and raising in community the awareness towards vaccination and surveillance of PPR and ND. And also something that was a bit unexpected, but what came up during the discussion was that there were evidences of things that were not anticipated, but that were actually positive outputs, such as the cows setting up their own businesses. And so what the final aim of our evaluation is to identify unexpected changes produced by the project. And so to do that, we define 3 key evaluation questions. This is really the core of the evaluation process, trying to identify these questions. And the first one is to see how the project contributed to improve vaccination. Second is how to improve surveillance. And the third is to see what have the stakeholders gained or lost from the project. Because the way we conduct evaluation is really to be not only focusing on positive potential impact, but also negative. So we really want to frame our evaluation where we can receive also potentially negative elements. And this is going to feed the lessons learned from the LIDISKI project in terms of how we manage the project, how we could do better in the future, and especially if you want to develop similar projects involving cows and solar panels and capacity building, etc., etc. If you can move to the next slide. So how we'll do that is that for all the 3 evaluation questions, we're going to identify changes. So changes can be very different in terms of knowledge and skills. So for example, are the cows able to better identify diseases? In terms of motivation, are they like really happy and looking forward to using the COBO tool that has been developed, for example? In terms of behavior, in terms of practices, so this is obviously, for example, implementing vaccination, and in terms of interaction, so this could be potentially the way cows will liaise with their supervisors. And to do that, we're going to collect some data. There's going to be different data that we're going to use. There are some quantitative data and some qualitative data. So part of it has already been collected through one participatory workshop. There's going to be another one this year. There's 42 interviews that are going to be collected, that are going to be conducted, like more than 2/3 of them have already been done. There's going to be focus group discussion with communities. They have all been conducted. And we're going to analyze, obviously, the database that has been produced through the COBO tool. And we're also going to look at other types of reports, such as like temperature recordings, vaccination cells, etc. And so all this data is going to be analyzed until May of this year. And then we aim to have like a restitution workshop with lots of different stakeholders to see this is what we found out. This is the result of the evaluation. Are you happy with it? Do you think we missed some important points of the data that we need to capture? So this is going to be done with farmers, cows, state officers, or a wide variety of stakeholders. And next slide. And then our final task is going to be to produce guidelines for the prevention and control of ND and PPR, so tailored to the context and expectation of stakeholders. So to do that, we're going to build on all the results of the evaluation, obviously, but we also want to liaise with all the different work package leaders and people who have been involved in the project. So the way we intend to do that is to organize workshop with key stakeholders. And so to use all the AP data, the socioeconomic data, the tool that Rafael has just presented, and try to see how we can, best conduct surveillance and vaccination in the future. And so we would present and discuss those guidelines at the end of the year in a workshop that will be held in Abuja. And I think that's it.
Yes, thank you very much, Sophie. All right. Any question? Do you see some question? Please. Don't see a question. Any comment from anybody? Now we are kind of open for the wider discussion. Of course, if you want to come back to some other points as well, we have a bit of time, maybe 10 minutes to go over the outputs and what's proposed for the last phase of the project. and we can share about that all together here. All right, so as we were saying, so these presentations were recorded.